Hello, this is Dr. Drew Taft, and this is another Fast Foot Fact. We're back again, continuing our video series on plantar fasciitis. All right, so this video, we're going to talk a little bit about how we treat plantar fasciitis. So the patients come in, we've kind of identified that that's what they have, and now we need to go into our treatment protocols and how we go ahead and fix it and get you better, okay? So a lot of how we manage this, again, is kind of a multifactorial or multi-directional approach, okay? Because again, there are several things that can contribute to why you develop plantar fasciitis, all right? All right, so the way I kind of break this down is, number one, we have to try to manage your symptoms. We got to try to manage some of that pain and inflammation, okay? So we do that with things like icing, anti-inflammatories, which include Motrin, Advil, ibuprofen, things like that. But we do also use steroids or cortisone. Sometimes it can be in the form of a cortisone injection or sometimes even oral steroids, okay? But all of those things are really just trying to help make you feel better, just trying to get some of the symptoms down, okay? But they're not necessarily addressing the underlying cause, all right? So we also have to make sure that we're implementing other treatment aspects to do that as well, okay? So going back to the last video, we talked about how inadequate support can be a big reason why people develop fasciitis. So part of the treatment is making sure that that support is in place, okay? So that starts with shoe gear, all right? We need to make sure they have a good foundation for the foot, good structure for the foot, because that's what's gonna start to take some of the load and the strain off of the plantar fascia. So generally nothing beats a good walking shoe or a good sneaker. Certainly there are much better options out there now for sandals and flip-flops per se. But even with those being available, I still tell people, to begin with, we really want to make sure we get your foot supported properly. So a good walking shoe or a good sneaker. And I will draw your attention to a link to this, to another video that I have regarding shoe gear and what to look for with a good walking shoe or sneaker. So check that out if you haven't, okay? But again, good walking shoe or good sneaker, that's kind of the foundation, all right? But a lot of times we'll also institute an orthotic or an arch support. I would say about 95% of people who I treat for plantar fasciitis ultimately get some sort of arch support. And that doesn't mean that you have a flat foot and you need an arch support. Just as many people who have high arched feet who have plantar fasciitis require that arch support as well, because the more that your arch is supported and contacted, the more we can distribute the pressure and the force off of the fascia to help alleviate some of the stress and the strain. All right, so shoe gear and orthotics, those are the two big ones when it comes to just supporting the foot. And then the next thing, again, is talking about the soft tissue components. We talked about the tight calf putting tension on the fascia. So another big thing that we'll start really getting aggressive with is calf stretching exercises. We really want to make sure that we're loosening up that calf muscle, which reduces the tension on the Achilles and then therefore reducing the tension on the plantar fascia. And you need to be aggressive with stretching, because if you're just stretching once or twice a day, it's never going to be enough. You really need to get yourself into the habit where you're carving out 3, 4, even 5 times a day to do some stretching. Now, these stretches don't have to be 20 minutes every time. It can just be a minute here, 2 minutes, 3 minutes, but just getting yourself in the habit of doing it, because that's what's ultimately going to help to take a lot of that tension off of it, okay? And that's a big reason why first steps out of bed in the morning are so painful, is because that calf muscle gets relaxed and tight during the night. And so then when you step on it first thing in the morning, because everything is so tight, it's going to pull harder on the fascia, which makes it hurt. So definitely stretching in the morning, using things like night splints can also be helpful to help with that stretching. Okay, so shoe gear and stretching exercises, managing the inflammation with the icing and the anti-inflammatories. But another big thing that we're using now for plantar fasciitis is something called pulse wave or shock wave therapy, okay? This technology has been around for a long time, but we're really finding good uses for it now in the musculoskeletal world. So this is a machine that creates a sound wave that penetrates down to, in this case, the plantar fascia. And what it actually does is it stimulates blood flow to the fascia. So it's actually trying to stimulate your own body's healing mechanisms, okay? It improves the blood flow, it helps to decrease scar tissue. So we're really finding that this treatment in conjunction with all these other treatment modalities can really help to get people better quicker, all right? So We've got some studies that are showing that this pulse wave therapy is successful in about 85 to 87% of the people with fasciitis. And we're also finding that people are getting better quicker with this kind of modalities and treatments. Okay, so that's something else that we do offer as well. Okay, so between the support with the shoe gear and the orthotics, the stretching exercises, managing the inflammation, and implementing some of these other modalities, including pulse wave, those are really kind of the staples. That's really what we start with. Okay, and I would say that majority of people just implementing those things, within a month of treatment, usually people come in and they're 50, 60, 70% better. Okay, so in a month, just with these simple modalities, we can really get people going in the right direction. Okay, so obviously everybody's cases are a little different, but that's generally where we start. Okay, so all right, great. Those are some treatment options, and last video we're going to do is just talk a little bit about prevention. Okay, and a lot of that is just coattailing off of a lot of what we're doing for treatment. Okay, but stay tuned and we'll talk a little bit about that as well. Thanks again for watching.